Big news on the vaccine front. This week, U.S. health officials gave final clearance for kids as young as 5 to get a COVID vaccine. I'm joined by Straight Arrow medical expert, cardiologist, Dr. Payal Kohli. Dr. Kohli, thanks so much for making time for us.
Great to be here, Gwen. This is such big news. I'm so glad we're talking about this.
We reached out to some of our viewers for any questions that they had. So the first question from quite a few parents was, where should they go to get their kids vaccinated? Do you need to go to your pediatrician?
So the good news there is there's lots and lots of sites where you can go to get your kids vaccinated, but sign up ahead of time because those appointments are filling up fast. So your pediatrician is probably a safe bet because most pediatrics offices have it, but you can also get it at retail pharmacies like Walgreens and Target, amongst others. We are not using those mass vaccination sites that we did for adults for kids because we really feel that it needs to be more personalized with more attention paid to them, making sure we're dealing with their anxiety as we're giving them the shot.
Our second question, Pam from New Jersey asks, if my child just had COVID, how long should they wait until they get the vaccine?
So there is a sweet spot for how long you should wait, and it seems to be about 2 to 3 months. And if you get the vaccine too soon after the infection, the antibodies may actually come and stick to the vaccine proteins and inactivate the vaccine from activating the immune system. So probably wait about 2 to 3 months after your child has had COVID to get them vaccinated.
For our third question, so according to the CDC, less than 700 children ages 0 to 18 have reportedly died in the U.S. since the start of the pandemic. So Tracy of Hawaii asks, if that's the case and their chance of dying is 0.001%, why bother getting them vaccinated for a risk that small?
So, when it comes to our kids, Tracy, there's so many things that we worry about besides just their risk of dying. And the COVID vaccine is really going to enable them to be able to do that, get back to after school activities. So even if they don't end up dying from it, they certainly can get very sick. They can have permanent organ complications. We know that COVID has receptors in the heart, in the lungs, in the reproductive organs, in the brain. It's not infection we want to expose our young kids to while all those organs are developing because we don't know what the long-term consequences are. So it really does protect them in many different ways, socially, psychologically, physically, and it protects all the adults that are around them.
Just to kind of finish it off, I am not a parent, but I am really curious for those young children. Are there trials going on? Is there any clarity on when the vaccine could then be offered to them?
Well, I'm really excited about this age group because my nephew falls into this age group. He's 4 years old. And we actually have trials ongoing with kids as young as 6 months, so little babies, all the way to 4 years. And the dose that they're using in this population is only 3 micrograms. So it's 1/10 of the adult dose. Remember, the 5 to 11 are getting 10 micrograms, which is 1/3 of the adult dose. And hopefully, because the trials are ongoing, it's the same vaccination schedule separated by 21 days. We should have some data to look at, hopefully before the end of the year or early next year.
Well, again, I want to thank you so much for your time, Dr. Kohli. I really appreciate it. And I know our Straight Arrow parents will appreciate all your answers as well.